my talk, I will go along with the topics, little with the introduction of the stem cells, which I will skip out a little faster because all of you are thoroughly well knowledge about it. You have been accomplished about the stem cell knowledge. Then let us see a small 1 or 2 slides in the global scenario, what is going to be in cancer. Here I'll insist cancer as a disease, as an epidemic. Why it is epidemic, I'll explain you. Then basic theories of cancer which fail in the therapeutic application. Then what is cancer stem cell? Conventional methods which we are striving hard with the most research, recent things happening, but still we are unable to find the cause for treating it. And the future. At the end, I'll speak little changing paradigms. In general, in the health sciences, where conventional and proven therapies, though whatever we talk of higher end of research, but still we could not treat them. So we have to happen to find out a parallel science, a separate science, what it can be used, which can science cure with all conditions. And if you see overall, since there was not a special preparation with me for a talk to be given here, so there are certain slides which in context with India I had prepared sometime. So those slides will be there, but we'll skip off those. This is a slide which is showing in Times of India, and will be showing the ratio of cancer which is growing up very fast. In 2014, if you see, we had 5 lakh people. Now within 1 year, if you can imagine the exponential growth, 7 lakh. This is what is happening with the growth of cancer. And every year we adding lakhs of people to the fatalities of cancer. The overall ratio seeing male and female ratio of cancer. This one slide which will be more highlighting the status in US particularly. This is a slide of showing 2010, where you can imagine the economy where we think of, at that time we are spending around 3.9 billion on medical expenses. You can imagine 5 years down the line what could be the cost have gone. It's not a question of how much money we are spending, but are we achieving our goals? Are we getting the results? Are we reaching the target, what we are doing for, the money being spent for? The ratio, if you can see the fatalities for cancer, where 25% of all the death, and globally 15% is a very high ratio, as well as if you talk of primary as secondaries. The ratio of secondaries is nowadays increasing compared to primary, for being that with the modern therapy, our life expectancy is increasing. The ratio of cancer is increasing because we are getting a cancer-free life, what we can call a cancer treatment after taking a treatment 4 year, 5 year, or second, third year. We get an opportunity, cancer gets an opportunity to bypass the secondary of metastasis. This ratio is day by day increasing. Now, this slide is a very indicative slide of aging diseases. Though I have written it as an Indian scenario, but if you analyze, this could be a global scenario. With whatever is happening in research, we are estimating the cost of treatment. If you analyze the cost which is going high, is not because there is something which you are bringing new. It is because we are adding a cost on a new research. It is definitely adding you life of expectancy increasing. Longevity of life is being increased. There is no question about it like. But have you analyzed all of your colleagues who have crossed 50 years of age? How many of them are disease free? Either they have a diabetes, hypertension, or any kind of cardiac disease, or diabetes has landed in some other complication, obesity. All these are morbid conditions which are adding to the aging factor. But all these diseases with the current therapies are unable to treat it. This is the greatest curse on the development what we are doing it. Like we are having a longer age, but we are having disease along with that. Now cancer I have put little higher up. Below that it's not on the top list, but it's on the second and third list of the aging diseases, organ failure, diabetes, then disease, autoimmune disease. These are added benefits, added curse we are getting with the modern science which are adding in life. But with the research we are not having any solution. That is why cancer I keep it in ratio where it's growing exponentially. Now in earlier slide, if you see in US, I want to light little here about the epidemic ratio. Cancer I call it an epidemic of all time. Why I call it epidemic of all time? We know in 19th and 18th century globally there were a lot of epidemics of infectious diseases, viral diseases, but they are time bound. We could come out some kind of vaccination therapies and we could cure them, and we could come out of those kind of epidemics. But analyze globally, if you see the way cancer is growing, so I call it all-time epidemic. Fatalities are going to grow. So there's a big difference in what we describe in other infective epidemic and epidemic what we see with the cancer. So it's a favorite topic of mine to describe it as an epidemic of all time. We are fighting against it, not having any solution. Cancer can take away all of my physical abilities. It cannot touch my mind, it cannot touch my heart, and it cannot touch my soul. This is an anonymous saying which states that still we have our challenges to face. Still we have challenges to face. And all those barriers, even if the physical ability has been taken, but still we can find solutions to the cancer. Before we go to the solutions of body cancer stem cell, we should definitely understand little bit research on stem cells. I have a brief favorite slide for you. This is a very good slide where you can analyze stem cell for its potency, stem cells for its genesis, stem cell for its source, stem cells as an application. All of us, when we talk, where does the stem cell comes from? Where it stays? What it does? Who controls them? What are their activities? This is a slide which is going to answer all these questions. Your master cell stem cell, the birth of the stem cell comes when there is a sperm and ovum fuses. That is the time where your stem cell has come into existence. We talk of bone marrow, we talk of all those. But your birth of stem cell has come, but actually the fusion of sperm and ovum. One cell embryo, single cell embryo, having a total potency character, can extraembryonic as well as embryonic, both of them can be developed. 220 types of cells could be developed from this. With all genetic expressions. At birth, the expressions may be very small, around 17 to 20 genetic expressions, but as the cell evolves, the expressions go on increasing up to 25 to 30,000 genetic expressions. Within 4 to 5 days, we reach to the stage what we call as morula or blastocyst, a sac filled with inner cell mass, which has got a marker of OCT4 and CDX2 for the presentation for the trophoblast cells on the circle, which may form the extraembryonic tissue. With this expression, the cell has lost the development potential into extraembryonic tissue, which each expression of the gene, the cell becomes specialized from an unspecialized cell. The potency comes to pluripotency here. Again, losing the potency into getting into extraembryonic tissue, but they have a potency to develop into total 220 types of cells and entire clone capacity. As after the period of 4 to 6 weeks, the real starts the genesis of ontogenesis or organogenesis. The cells become specialized with the expression of specific genes, and we call them as progenitor tissue specific cells, fetal progenitor cells. At this stage, still patient, the baby has got some embryonic character. We call them as embryonic or totipotent or pluripotent cells, depending on the stage where we catch. There are a lot of other issues, so we don't want to speak anything about this totipotency of the cell, which all of you know. We will go towards the history of the presentation with the autologous stem cells. At the birth time, this potency of the cell goes to multipotency, and every organ remains with the progenital cells, and multipotency remains in the bone marrow. Now these multipotent cells at the birth, cord tissue, embryonic fluid, cord blood, placenta per se, all the cells has got multipotency. Early years of gestation period, embryonic, particularly amniotic fluid, has got a little pluripotency also. these cells, as they maintain two types of activities in our body. One is development in the first phase of your life, where your organs are getting developed up to the age of maturity, age of around 17, 18 years. And once that job of development is done, the stem cells play a major role to maintain the homeostasis of your body. Wear and tear, because whatever the lifestyle we live, every adult cell has got a programmed death. So these cells to be replaced by coming in stem cells. The mesenchymal stem cells have a multipotency character, which they play a major role. This one slide has got a very favorite type of mind who can elaborate everything about the stem cell. The contrast of the stem cell, I have clearly mentioned you when we are talking at the beginning of the session. Stem cells have a big contrast to understand. At one end of the top, when we say always analyze the master cell, the ultimate job is regeneration. We never believed it could be a cause of cancer. We always think stem cell is a theory of regeneration because of its three major characteristics. One is anti-inflammatory, immunomodulatory, and they can replicate and differentiate. But we never thought there are other three properties of cancer stem cells which can be used in the cancer therapies by the theory of cancer is a potential cause of stem cells. A stem cell is a potential cause of stem cells, a cancer. This I'll tell you at the slide when we are going to go. Cancer, as I need not describe you much, is an heterogenic DNA and genomic malfunction. Theory of causes of cancer. I was in the beginning of my talk, I was mentioning the different hypotheses which we have come across till date. We thought of viral as a theory, failure of immune system. Genetic remained a very important cause. In between, there's a big talk on it, and we proved that it could be a cause in some few number of cancers, not all of them, particularly hematological disorders. This somatic mutation has led a very good cause to explain cancer stem cell, and theory of carcinosis, which was taught in our classical academic coaching and teachings, has remained as a theory only, but hypothesis, but it cannot be proved. It plays a role definitely, but it cannot be a cause. Genetic oncogene, as I spoke you, it could be a better cause than hematological disorders. Cancer is a genetic mutation, genetic disease driven by mutation. Now, this slide says us the hypothesis has been very close to the final conclusions to isolate even the cancer stem cells. Variation in cancer among tissue can be explained by number of stem cell divisions. The lifetime risk of cancer of many different types is strongly correlated, that is cohort 0.81, with the total number of divisions of the normal cell renewing system to maintain the normal tissue metastasis. This is a very important point to understand. We have different tissues in our body. Some of them are proliferating very slowly, like brain, heart, whereas some of the tissues in the body, they proliferate very fast, like intestine, liver, skin. Now, the chances of mutation take place more in the tissue which has got high proliferate ratio. That leads to understand a 0.81 cohort to understand 65% of the cancers can be developed because of mutational accumulation at stem cell level in the niche of a cell. A linear correlation equation of 0.804 suggests that 60% of the difference in cancer risk among different tissues can be explained by total number of cell divisions in those tissues. Stochastic effect of DNA replication appears to be a major contributing cause to the cancer, not the carcinogenesis. This speaks, the slide shows, it is not clearly seen, but it shows that with the proliferation ratio, how the chances of increasing malignancy in those specific tissues is higher. So we write, the concept underlying the current work is that many genomic changes occur mainly by chance during DNA replication rather than a result of carcinogen factor. That is why I call this stochastic effects. By chance, we cannot control this. We cannot control these changes which are coming. So ultimately, science is not is not known to any country or religion, but knowledge belongs to humanity and is a torch that illuminates the world. This is where we have come to the conclusion, yes, stem cell has remained as a cause where the multiple mutations which take place at the level of niche in an organ where high proliferation ratio is maintained. Accumulation of this mutation leads to create a cancer stem cell. Here, somatic mutations are accumulated only in the stem cells. Mutated phenotype is a stem cell attributor, and therefore cancer is a stem cell disease. If you see replication, excuse me. Now, as I was explaining you, in a niche, this is a small diagrammatic presentation of a niche of organ where the stem cell, when they replicate under the influence of a niche cell, which controls the passing of signals and extracellular matrix which controls the signals which will pass to stem cell to differentiate, either go in a differentiation by asymmetrical division to differentiate into specific tissue cells, or to maintain the pull of a stem cell in the organ to maintain the homeostasis of the organ by replication that inherited by the stem cell. If at this junction where the stem cell, if you can see, this is a junction where I will say, this is the place Brent, pointer cannot show.
Yeah, good.
This is a stage where if the accumulation of mutational changes take place and replication takes place at this level itself, the cancer stem cells are produced. These are rare events taking place. You know, every cell has got a program that or surveillance system in their body which can take care of in early mutation changes. But when the mutations takes place beyond, heterogeneity is so high that every cell divides, there is heterogeneity. And we call them the cancer stem cell. These cells, they can get into any normal tissue because they don't have adhesion potential more, and hibernate in normal tissue also as a secondaries, or even the, you can say, metastatic cells. So difference between a normal stem cell and a cancer stem cell remains, though there is a heterogeneity, but in this, when the cell differentiates, the mutational changes are less likely to take place because genomic changes are very less in a differentiated cell. Whereas in a stem cell, the chances of genomic changes taking more are there because every mutation collection will be an additional burden on the cell, and every cell is a heterogenic cell then. The difference between a normal stem cell and cancer stem cell. In fact, while going at, if you have some questions, please, you can interfere in me, ask me, so that we can have an interactive session here itself. Now, when we talk about cancer stem cell, it should have its own markers. So CD133 and ADL has been a common marker. Remaining markers remain as a different marker depending on the tissue of proliferation where the cancer cell originates. Now, this is one where you can realize where the Neostem is the biggest company in the US which has been working on cancer stem cell. But we should play a video. So I'll just brief what it says here. This Neostem is the first company in the US who isolated the cancer stem cells, and how the immune system can be educated to attack the cancer stem cells, particularly NK cells, and these cells has been come as in therapeutic applications, which we see subsequently in subsequent slides. Now let's see the current strategies like mechanical, surgical, physics, radiotherapy, chemistry, biological, that is immunotherapy. Immunotherapy has been added to the standard therapies nowadays. But there are a lot of new concepts are coming in coherence, synergy with the stem cell therapies and the chemotherapy, radiotherapy, how to sensitize the cancer cells to immunological cells.